Did you know that knee replacement surgeries in people under 50 have increased by 188% in the last 2 decades? Not in old people, in people your age. And the worst part is that by the time your knees start hurting, the damage has already been happening silently for years. But here's what shocked researchers when they studied Japan. Men and women in their 40s and 50s are climbing stairs, hiking, sitting cross legged on the floor with zero knee pain. When Stanford researchers went to find out why, they did not find expensive treatments or special medicine. They found five simple daily movements that take less than 10 minutes a day. And one of these movements was linked to a 60% reduction in knee joint deterioration. So if you feel stiffness when you stand up, hear clicking in your knees, or want to make sure you never need a knee replacement at 55, stay with me. Before we begin, here is one thing most doctors never tell you. Your knee cartilage has no blood supply. It gets its nutrition only through movement. So when you sit for 8 to 10 hours a day, your cartilage is slowly starving. This is why your knees feel worse after long sitting and why morning stiffness gets worse every year. These five movements fix exactly that. Now let us get into it. And before we do, drop your age and your main knee symptom in the comments below. Right? I read every single one. Number one, Sampo, the Japanese art of slow walking. When you walk fast and distracted, your foot lands heel first with full force, sending a shockwave straight into your knee 8,000 times a day. Sampo fixes this by following one simple sequence: heel, then middle of foot, then toes. Slow and deliberate. This rolling motion activates all 33 joints in the foot, distributes impact evenly, and retrains your body's natural shock absorption system. Studies showed a 47% reduction in knee joint impact per step and significant reduction in knee clicking within just 6 weeks. To do it, walk 4 to 5 times slower than your normal pace in a hallway at home. Focus on feeling each part of the foot touch the ground. Just 3 minutes daily is enough. The biggest mistake is rushing. The goal is not distance. The goal is joint awareness. Number 2, balance on one leg. Try it right now. Stand up, lift one foot, and hold. If you lasted under 30 seconds, your knee stabilizer muscles are already weaker than they should be. 80% of knee deterioration comes not from the knee itself, but from weakness in the muscles surrounding it. Single leg balance trains exactly those muscles. Japanese adults who practice this daily showed a 60% reduction in knee cartilage wear and 44% fewer knee-related doctor visits. To do it, stand near a wall, lift one foot slightly off the ground, fix your gaze ahead, and hold for 15 to 20 seconds per leg. Build towards 60 seconds over time. Do not look down at your feet and do not hold your breath. These two mistakes alone cancel out most of the benefit. Number 3, the horse stance, or kibadachi. There's a small muscle on the inner side of your knee called the VMO, and this muscle is the primary protector of your knee joint. And for most people who sit at desks and live modern sedentary lives, this muscle is almost completely inactive. When the VMO goes weak, the kneecap tracks incorrectly and grinds with every step. That grinding over years becomes the knee pain people blame on aging. It is not aging, it is a sleeping muscle. The horse stance wakes it up. Research showed a 24% increase in VMO activation and a 31% reduction in kneecap tracking problems after just 12 weeks. To do it, stand with feet wider than shoulder width and bend your knees as if sitting into an invisible chair. Keep your spine straight and push your knees outward the entire time. Hold for 15 to 20 seconds and do 3 sets daily. If you need an easier version, press your back against a wall, and slide down until knees are at 90 degrees. Number 4, heel raises. Let has the movement linked to actual cartilage regeneration, and most people over 30 are completely ignoring it. Your calf muscle controls the final push of every step. When it is weak, the knee absorbs force it was never designed to handle. On top of that, your calves pump blood back up to the heart, and that circulation is what feeds your knee cartilage. Weak calves mean starving cartilage. A study with Japanese adults between 35 and 50 showed a 38% improvement in knee joint fluid circulation and measurable increase in cartilage thickness on MRI scans after just 8 weeks of heel raises. To do it, stand with feet shoulder width apart, rise slowly onto your toes as high as possible, hold for 1 to 2 seconds at the top, and lower slowly. Start with 2 sets of 15 repetitions. The biggest mistake is bouncing. Slow and controlled every single rep, every single. Number 5, the resting squat. In Tokyo parks, you will see people in their 50s and 60s sitting comfortably in a deep squat, heels flat, back straight, completely relaxed. Yep. Try it now. Squat all the way down and keep your heels on the ground. If you lasted less than 30 seconds or your heels came up, your knee cartilage in its deepest range is not getting fed. The knee joint was designed for this position when you never use its full range. That cartilage slowly thins and calcifies. Research from the University of Tokyo found that people who practiced resting squats daily had cartilage density 34% higher and a 70% lower chance of developing chronic knee pain. To do it, hold on to a door frame, lower into the deepest squat you can manage with heels flat on the ground, and hold for 20 to 30 seconds. Build toward 2 minutes over time. If your heels come up, place a rolled towel underneath them until your flexibility improves. If you already have knee pain, here is your simple daily plan. In the morning, do 15 heel raises, then balance on one leg for 20 seconds each side, then Sampo walk for 2 minutes. In the evening, hold the resting squat for as long as comfortable, then do the horse stance for 30 seconds, and finish with 2 minutes of Sampo walking. That is it. Less than 10 minutes a day. Within 3 to 6 weeks, most people feel measurable reduction in stiffness, better comfort on stairs, and less clicking in the joint. Always start with wall support. Mild muscle burn is good. Sharp joint pain is a stop signal. Your knees at 60 are being built by what you do at 40. You do not need a gym, a trainer, or surgery. You need 10 minutes a day and a decision. Start with just one movement today. And tell me in the comments which one you are starting with. If you already have knee pain, share your main symptom and I will reply with exactly which movement to prioritize. Strong knees are not just about staying active. Strong knees are how you stay free. Thank you for watching.